hematology, oncology, pathology, Hodgkin versus non-Hodgkin lymphomas. So for this first video, I'm just going to be honing in on Hodgkin lymphoma because non-Hodgkin lymphomas are a large subset that need its own video for. But to just discuss Hodgkin lymphoma, I think the first thing that I would definitely do when attacking the cancer sections overall is watch the sketchies for them. I think sketchy is a great tool to be used for drugs and bugs, but the one exception to that drugs and bugs rule is that I also watched it for cancers, and it helped so much in further understanding what happens and all the little details that I needed to memorize, because a lot of it is memorization for cancers. And so to really help you with the oncology aspect of hematology oncology, I think you should definitely watch the cancer videos that are on sketchy. But I'm going to try my best to kind of give you the highest yield things that you need to know for oncology, and it should be pretty helpful for just like quick hitters that you must know and must memorize. All right, so the first thing I'm going to be discussing is Hodgkin lymphoma. Now, the thing that defines Hodgkin lymphoma is that it contains Reed-Sternberg cells. In Reed-Sternberg cells, what you have to understand is that you have to see what it looks like under microscopy, okay? So right now, look it up online, or if you're looking at it in your book, make sure you see what Reed-Sternberg cells look like, okay? It's very, very important for understanding. Hodgkin lymphoma presents with Reed-Sternberg cells. It's a bilobe nucleus, and so a lot of people describe it as owl eyes, but you have to know what that looks like because they love to show histology associated with Hodgkin lymphoma. And if you see that, it's a dead giveaway, okay? Now, these cells stain positive for CD15 and CD30, okay? And that's another thing that you have to understand. So for a lot of these lymphomas, they're going to provide you with so many different markers, whether it's translocations of chromosomes or whether it's CD markers. So make sure you understand the specifics for each one. Hodgkin's lymphoma, so far I've given you two things. One is the Reed-Sternberg cells. Two is that it's CD15 positive and CD30 positive, okay? Another thing that's important for Hodgkin lymphoma is that all of these cells arise from one specific B cell. So it's B cell origin, okay? And they come from a single group of nodes. And the specific nodes that they like to spread to is in a continuous manner. So what does that mean? So if I start in a node that's located in my neck, it's going to spread continuously along my lymph node drainage way, okay? So it's in a continuous manner. Whereas if I contrast that to the non-Hodgkin lymphomas, they spread sporadically. I might have one in my lymph node located in my neck, and then the next one that I find can be located in my groin, right? So it's not automatically a line or a chain in which it spreads. Compared to Hodgkin lymphoma, yes, it's a contiguous spread, okay? Contiguous spread, okay? And it has a better prognosis compared to non-Hodgkin's lymphoma. Lastly, they like its association with EBV. However, non-Hodgkin's lymphoma does have association with EBV as well. There's multiple subtypes of Hodgkin lymphoma, which they don't really go into, and it's not very high yield. So I'm not going to spend our time wasted by describing those subtypes. So what I will say, what you need to know is one, Hodgkin lymphoma stems from one single B cell from a group of nodes that spreads contiguously. It has a better prognosis, and it's characterized by Reed-Sternberg cells with CD15 and CD30 positive. It has, lastly, a bimodal distribution, which just means that it's more likely to come at a younger age as well as an older age. So it can be highly associated with 18-year-olds as well as 65-year-olds. So that's what they call bimodal. There's two age groups that are at an increased risk. That's all for Hodgkin lymphoma.